Most people don't realize how cruel the health insurance system is until something happens to their family. As long as you're healthy, insurance feels like more paperwork. It's annoying, overpriced, but distant. And then somebody in your family gets sick, and suddenly you find out the truth. In this country, treatment isn't simply about what medicine exists. It's about whether somebody decides you qualify for it. And we live in one of the richest, most technologically advanced countries in the world. But when a person needs treatment, the response is more often than not, fill this out, call this number, wait for approval. You might have to resubmit your claims, appeal the denial process, and prove it's medically necessary. And maybe if you survive the process, you'll get what you needed in the first place. That's not healthcare. People are being denied treatment, not because the treatment doesn't exist, and it's not that their doctor doesn't know what to do, but because they don't have the right insurance plan. They didn't jump through the right hoops, or they might not have enough money to pay the difference. Two people in this country can have the same exact illness, need the same exact treatment, and have completely different outcomes because one has better insurance, not because one worked harder, not because one deserves to live more, but because one has the right card in their wallet. How is that defensible? And insurance isn't the only place where money has worked its way into the healthcare system. Pharmaceutical companies have financial relationships with doctors, other healthcare professionals. And I'm not saying a doctor or every doctor who receives money from a pharmaceutical company is corrupt. But let's not pretend there isn't enormous amounts of money moving around this system, because there is. And when that much money is involved, incentives matter. There's a lot of money moving around a system that's supposed to be about one thing: keeping people healthy. I also think it's a bit odd to see commercials for prescription drugs. Ask your doctor if this medication is right for you. Think about how bizarre that is. The person watching the commercial isn't a doctor. They didn't go to medical school, but they're being marketed a prescription drug and encouraged to ask their doctor for it. And why? Because pharmaceutical companies are a business. Their job is to sell drugs. I'm not blaming them for trying to make money. I'm just asking whether we've allowed the profit motive become so deeply embedded in our healthcare system that we've forgotten what healthcare is supposed to be about. Somewhere along the way, the patient became the customer, and the insurance company became the gatekeeper. Everybody has a financial interest in what happens next except for the patient. And when someone you love gets sick, you shouldn't have to beg for healthcare. You shouldn't have to negotiate for survival. It should be, what is the best way to treat this? What treatment does a doctor recommend? But now you're not just fighting the disease anymore, you're fighting the system. And an appeal process that takes so long, the patient gets worse while everybody decides or argues about who's going to pay next. Yes, the treatment exists, but not for you. We know your doctor recommends it, but it's not in your plan. Yes, this could save your life, but we need pre-authorization. This system kills by making healthcare possible, but practically unreachable. And people give up. They're exhausted. They're sick. they can't take any more time off work, or they don't understand how the system works. Maybe they simply just can't afford it. You hear how insane that sounds? Your claim is denied. Your medication isn't covered. Your doctor isn't in network. Your treatment requires prior authorization. I'm not saying healthcare shouldn't cost money, but there's a difference between healthcare being expensive and healthcare being designed around a financial system that nobody can afford. When a doctor says you need something and the insurance company says you don't, when life-saving drugs exist, but you can't afford it, we have a problem. The purpose of health care should be simple. Help the sick get better, not how much can we bill. It shouldn't be, will the insurance company approve it? Is this in network? Did we hit our sales target? The patient should come first. But somehow the patient has become the smallest part of it. When somebody is sick, they need treatment. They don't need another phone number to call. They need a doctor who can treat them. And no nation should call itself advanced while people are being priced out of survival. No nation should celebrate medical breakthroughs that ordinary people can't afford. What good is the best healthcare in the world if the person who needs it can't get it? People are tired of being told it's complicated. They're tired of being told to be patient, and they should be. Because healthcare should be about health, not profits, not who has the best insurance card. When someone is sick, the first question shouldn't be, how much money can we make on this? It should be, what can we do to help? I'm just saying. My name's Quentin. If you like this video, don't forget to like and subscribe. Until next time.